everyone, welcome to eTimes Lifestyle. I'm Kansan Churin, a lifestyle journalist, and today, on this special occasion of National Doctors Day, we have with us four esteemed doctors who will help us understand the challenges they face throughout their busy schedule and also discuss everything around doctors' burnout, something that is often overlooked and impacts both physician and patient care. Today we have Dr. Saurabh Mehrotra, Senior Consultant, Institute of Neurosciences, Medanta Hospital Gurugram, Dr. Saurabh Pokhariyal, Head of Department Consultant, Nephrology, HCMCT Manipal Hospital Dwarka, Dr. Meenu Vashisht Ahuja, Consultant, Birla Fertility and IVF, and Dr. Vinayak Agarwal, Director and HOD, Non-Invasive Cardiology, Fortis Memorial Research Institute, Gurugram. Welcome, doctors, and it's a pleasure to have you all on board.
Thank you.
Thank you.
So, doctors, let me first begin by asking each one of you about your own experiences with burnout and why do you think it is so crucial to talk about it? Dr. Mehrotra, would you like to begin?
Yes, absolutely. Most of us over a period of time do experience burnout. Now, burnout is something which happens over a period of time, but now we know that burnout is even common in medical students. So it starts at a pretty early age, as far as our medical career is concerned. The reasons for burnout are many. One is the nature of the job itself. It's a high stressful job. You are dealing with individuals who are unwell, sickness. There's a lot of pain and misery people are going through, as well as, people who may not survive or be dead, as well as family members who are, emotionally very, very distressed. So the nature of the job itself brings in a lot of stress. Add to that, the working hours which doctors have are, long working hours, very infrequent breaks, night duties and night calls. So that itself is something which adds to the stress over a period of time. Over a period of time, what has happened is that doctors are now very prone to litigation. The society seems to be developing a lot of distrust with the doctors. So that's also adding the nature of our interactions with the consumers or the public is, again, becoming more and more difficult. And there's another very important aspect of burnout, which we need to know, is that burnout among women doctors is higher as compared to men. And it's now being said that women are working 3 shifts. One is home, the second is work, and the third is work plus home, additional work and home. So of late, what has been noticed is that in professions such as obstetrics and gynecology, pediatrics, which are, which have a lot of women in them, the burnout rates are expected to be much higher.
Dr. Ahuja, would you like to add to that, to what Mr. Mehrotra said about women facing more of burnout than men?
Absolutely. Being a mother, obviously a gynecologist, it's been quite a task, handling both your work and your home. It definitely, one always has to, as a woman, you cannot really overlook any one of them. These are not the times when a woman thinks that she's any less than a man. So you have to give focus to your career. You have to be a good mother, a good, support at the family level. So yes, there is that stress, but going forward, I think all of us doctors have to realize that we can't really, expect a whole lot of things from us. There will be a certain, loopholes or some lacunae. We cannot afford them on the professional front, but yes, maybe the family life or our children, our families have to understand that somehow we will not be the perfect mother, the perfect wives, or the perfect homemakers. So that is something, an understanding that our families have to develop, and I guess they do, and that's why we are able to move forward as we do. Otherwise, it's just not possible. And so I think this, as a doctor community, we need to communicate to our patients that yes, we are there for you, and I think most of us try and do our best for our patients. We always prioritize them and always put our families, behind our work. But again, the society as a whole should also kind of, give us that kind of support, and understanding.
My next question is to Dr. Pokhariyal. So as a doctor, what, according to you, are the factors that contribute to a doctor's burnout?
Right. So, as Dr. Mehrotra and Dr. Ahuja very clearly put it, I think the main issue which, kind of contributes to burnout is the amount of hours most people are putting in without a break and at the expense of, their normal life. And, the bottom line for it is that we need to have a work-life balance, and it works both ways. So, what happens is the expectations of the patients we treat and the expectations of the doctors from themselves. Our community, unfortunately, in our country is not structured the way it should be. If a doctor can go home at 6 in the evening, they are almost always, and I speak from personal experience and I speak for the other doctors as well, they are almost always expected to be available on the phone all the time. Because a lot of times the hospital systems, the healthcare system is not structured that, if somebody goes home, there's another team, there's a night team able to look after that patient. There is no communication. And the same thing, the doctors also feel obligated. Now, what happens is the expectations from both sides become so high. And on top of that, you add something like COVID, which happened in the last 2.5 years, where apart from these expectations, you were also expected to look after your children at home. Kids were getting, online schooling. You were supposed to protect your parents from getting infected because you're going to hospital every day, but you're coming back to your elderly parents. You're expected to protect your, the members of your family from getting infected. And all of that led to a lot of burnout. So I think a lot of restructuring is required the way we practice our healthcare.
Dr. Vinayak, so as a doctor, do you also think that the responsibility, the duty that you have towards your patients, the pressure of it all, takes a toll on your mental health as well?
So I think what we were discussing is that there are it's a complex question to begin with. If you look at life of a doctor, it starts with very rigorous studying, training, getting through competitions. And when you actually reach the clinical stage, you realize that the tough part is now. You actually deal with human lives, taking decisions at every single moment. Each of your decision carries a significant outcome, which can even make a difference between life and death. And imagine that you're doing this day in and day out. You're doing it. There is 24/7 job. I mean, we get calls every single night. Now, the problem, and if you look at the reason why we go into a burnout is, I can handle that pressure if I'm appreciated for it by the community that I work for. If I'm reasonably paid well, commensurate with what I do. If I am recognized as an important member of the society, which is an integral part of the society. And there is a lot of security which is given to me because of the high stake job that I do. If I am made a scapegoat for the inefficiencies of the administrators, governments, I'm the soft target in the hands of the patient. The patient looks at me and says, I am charging a lot of money. That's wrong. I mean, if you look at the way the system of billing happens in private hospitals, the doctors probably will get a very small amount of that total bill as part of their remuneration. But then the patient doesn't know that. And we become the scapegoat we are the whipping boys for, say, everything which is ill in the society, in the medical community. I'm not saying that some measure of onus lies on us for creating, say, a sense of purpose, a sense of loyalty, and a sense of ethics, which is very, very integral part of our lives and as doctors. But the community at large is carrying a notion that the medical practitioner today is not as ethical or as steadfast in their work, in their approach as they should be. And that is wrong, because if you ask me, there is not one very big difference between our profession and any other professions, is that not a single doctor would want the patient not to get well and go home. Our intentions are 100% pure always. You cannot question that.
So, Dr. Mehrotra, As a senior consultant at the Institute of Neurosciences and a mental health expert, what can you tell us about the signs of burnout one should look out for, especially in working professionals like doctors?
So one of the first things, or one of the most important things which happens, is a state of exhaustion. You just feel tired, right? You feel emotionally very flat. You may feel disinterested in your work. You may feel that, I just want to finish my work and just get back home. The enthusiasm as far as your work is there, that tends to diminish. It's not as exciting. You don't really start looking forward to the work. So you reach a stage of physical exhaustion, you reach a stage of mental exhaustion, you feel emotionally very flat. Then this may, progress on to becoming very cynical about things, becoming rather critical, becoming irritable, right? On occasions, even going on to anxiety and sadness. And finally, it reaches a stage where you are unable to perform. You're just carrying on with your day without the interest, without the engagement, without the involvement. It starts appearing like a bit of a, burden to you. And that's where your quality of care begins to diminish. Patients do not have the good experience which they are expected to have out of you. And there is this additional risk of, some medical errors which may start coming in.
Now that we have discussed what doctors' burnout is and talked about the signs and the aspects around it, could you each please tell me what can be done to manage doctors' burnout? And are there any strategies, that can help curb the problem?
I'm not a psychiatrist, so, I really can't tell you how to handle burnout, but there are things we've instituted in our team which we feel are common sense measures. So, in our team, we have fixed timings for our consultants and residents to work. And we do shifts so that everybody gets free time. So nobody in the last 2 years is now staying beyond 5 p.m., which was unthinkable before that. I mean, we would be in the hospital till, extremely late. And this has been a very, very considered decision that, in these tough times when, everybody's scared, the family is scared, they're worried about our safety, we are worried about their safety. People will go back on time, and one person will handle the phone calls for the rest of the evening for that night in conjunction with the ICU team. So I've ensured that in our setup, everybody gets time off. Everybody works around 8 hours a day, at least 4 to 5 days a week. 1 day a week, they might work a bit extra. Sundays, similarly, we've split. People in the early phases, what we did was we split our team. So we were not coming to hospital daily either. Though I'm a nephrologist, our dialysis unit works 365 days a year. It can never shut down. We had dialysis patients. Dialysis patients carry a disproportionately high mortality of COVID. In COVID, dialysis patients carry roughly a 20 to 30% mortality. So, we had extremely sick patients. But even at that time, what we made a considered decision again was get half the team in on one day, half the team in on the other day, so that we are not cross-exposed to each other. We get time to protect ourselves. We get time to protect our patients from that. And that even now that the COVID thing has started settling down, we are not seeing that kind of sickness, that kind of, acute illness with COVID. We've at least maintained our working hours. Colleagues in my team also have once a month, they get to do a 5-day week. So they can choose a Saturday not to come in. And that allows them to spend extra time with their children. That allows them to, get ghar ka kaam done, which all of us all the time crib that a lot of things get left over, which we end up then doing on Sundays. So we've taken decisions like these. And the final thing, I think, in our team, what we've instituted is if somebody asks for a leave, that leave is afforded, no questions asked.